So we continue with our focus on this report. Joining me now is Mr. Tshepo Komape, who is the chair of the Independent Community Pharmacy Association. And Daddy, thank you so much for your time this afternoon. Your response to the Section 59 investigation report that was released a short while ago. Any surprises there for you?
No surprises at all. Let me first start by greeting you, Tammy, and viewers at home. My name is Tshepo, obviously from the Independent Community Pharmacy Association. We as ICPA, Tammy, I can tell you that we are not really surprised by anything that is coming out of the interim report. As the chair of the panel rightfully stated, that their work was to unravel what is actually going on in this industry of ours in terms of the treatment of healthcare providers and healthcare service, some of our colleagues. Now, as ICPA, we stand firm in condemning the ongoing treatment, unfair treatment that has been meted out to our colleagues in the industry. As we represent the pharmacists particularly, I can tell you, Tammy, that there are pharmacies that had to close, and there are people who had to really take up employment when they actually owned their own businesses, simply because they were no longer being paid by the medical aid scheme. Now, when you interrogate what actually went on to try and establish why would a practitioner end up having to close their store and opt for employment, you will find that indeed the level ground was not fair on them in terms of the processes followed in order to interrogate them and their practices. If there was any query from the schemes to the healthcare professional, you always find that there is a bullying tactics. Either you acknowledge that you were wrong, even if you were not wrong, even if you believe that you are innocent, you must sign what we call an acknowledgement of debt. The acknowledgement of debt, Tammy, is a contract which the scheme binds you to admit and accept that you have done fraud or you have done wrongdoing in your practice, so that you can then therefore pay back the money that you would have supposedly claimed. Now, if you look at the negotiations of such AODs, you are always going to find that it is actually being enforced onto the provider rather than it being negotiated. So in this kind of scenario, Tammy, the report doesn't really shock us. We were just waiting for the day that this will come to light, because this has been going on for far too long. And people, unfortunately, have committed suicide as a result. Now, this is actually the beginning, if I may put it that way, that it is important for now the regulator to take this opportunity and take a stance in support of the healthcare providers and say, this must come to an end. And how is this going to come to an end? A tribunal must be established, Tammy, where every practitioner that was unfairly treated can and should submit their grievances and submit whatever that they paid unfairly so that they can be paid back. I think for me, as ICPA chair, I will call for restitution in the form of what we have seen in our country, in the form of the TRC, for example, that there must be some kind of a tribunal where people will formally submit their challenges and what they've been robbed of by the industry, so that they can be repaid back whatever that they've been robbed.
I mean, what you're talking about here is something quite systematic, and this is something that Dr. Komape had said as well, that these are not random acts, but it's actually something systemic, that at times it doesn't seem like it was even intentional, but that is the way that it ended up going. Some of the numbers that come up is that MedScheme was 330% more likely to identify black providers as committers of fraud, as well as wastage and abuse. And by black, I talk about Indian, and I include colored as well. What has been your experience as the Independent Community Pharmacy Association and your members? And I just want to zone in a bit here on MedScheme, because their numbers are exponentially higher than the others, which are GEMS and Discovery.
Thank you, Tammy, for that question. As the ICPA, we have really been engaging with some of this scheme, and in this case that you are mentioning, MedScheme, Indeed, we did formally approach MedScheme to try and find a way forward with regards to this kind of practices from their forensic unit. And Tammy, I can tell you, the first thing that you get is a rejection and a flat denial, which is rightfully pointed out in the report by the chair, Advocate Mugai Toby, when he mentioned that the first approach that the schemes have taken when they were invited in this to give their side of the story. You will note that they started first by rejecting the allegations. Only when the proof is now being put on their table are they now starting to admit to say, indeed, they would have gone wrong here and there. But I can tell you that we have tried to engage them formally so that we can find some common ground on these matters, especially on unfair procedural ways of doing things. The entrapments and all sorts of behavior by the forensic unit and going back as far as 3 years and asking a practitioner to provide evidence of whatever that they've claimed in as far back as 3 years back. Obviously, Tammy, if I'm asking you a report that consists of 3 years of paperwork, you are likely going to come short in some instances. And it is in those instances that you are now deemed fraudulent, just because you are unable to provide some of the evidence. Now, from us, Tammy, I can tell you, we are happy that now that this situation has come to light, we believe that this is the time. Are you still with me, Tammy? Yeah,
yes.
We believe that this is the time where government must come to the party through the CMS and invite all associations so that they can put their cases forward, and then we can at least find some form of retribution, because that goes without saying if you read that report, Tammy.
Dr. Komape, thank you so much. We'll leave it at that for now. Thank you for your contribution and also putting your case forward on behalf of the Independent Community Pharmacy Association, Mr. Tshepo Komape there, talking about the fact that there needs to be retribution and advocating for a sort of tribunal to be formed, and those who have lost their monies, and in some cases there's some medical practitioners who have gone into depression, who've lost their practices, who've lost their livelihoods, and in some instances were so depressed that they've gone to the extent of losing their lives. Mr. Komape, they're saying that there needs to be some sort of a payback for that.